when you and I first met is because you came on my podcast to talk about this wonderful book that you'd written about loneliness. You're one of the world's great experts on loneliness. Even apart from your work as Attorney General, you got interested in that in your first pass through Washington. And then you wrote and spoke about that and had a best-selling book on loneliness in your time away from the Attorney General's office. And now you're back and you're linking it up, of course, to the work you're doing on almost everything else. So let's talk a little bit about loneliness and let's start by just kind of giving the top line view. Why are you so worried about loneliness? And when you and I first talked about this, I said, what's the biggest public health crisis in America? And every time we've talked about that, you didn't immediately say the coronavirus or gun violence or anything about the climate. You said that loneliness is the predominant thing that keeps you up at night, not personally, but for our nation. So talk a little bit more about that. What is loneliness and why is it such a big problem in America today?
Yeah, I truly believe that this has become the great public health challenge of our time. And I would even go beyond saying the public health challenge to saying societal challenge, because the more you understand about loneliness, as I know you understand so well, Arthur, when we are lonely, it impacts not just our health, but how we function in school, how we perform in the workplace. It affects whether or not we come together in the face of adversity as a community, whether that's a pandemic or a natural disaster. It affects a lot. And I got concerned about this because I was traveling the country in my first stint as Surgeon General and just hearing from people all over America, young and old, who were talking about their struggles with loneliness. They used different words. They didn't use the word lonely all the time, but they talked about feeling invisible, feeling unseen, feeling like they carried all the burdens in their life by themselves. And as I dug into it, there are two things that became very clear. One is that loneliness is exceedingly common. 1 in 2 adults struggle with measurable levels of loneliness, but the numbers are actually even greater among young people, despite, and perhaps in some cases because of, how much technology they use, social media in particular. But the other thing that became very clear to me, in addition to how common loneliness was how consequential it was. Turns out when we're socially disconnected from one another, it increases our risk for depression, anxiety, and suicide, but also for physical illness, for heart disease, for premature death, for dementia, as well as for stroke. And I was really stunned when I learned of the data that showed us that the mortality impact of social disconnection is on par with smoking daily. It's even greater than the mortality impact that we see associated with obesity. And smoking, obesity, we think of these as classic public health challenges, as vital to invest in. It turns out loneliness is just as important. So this is why, to me, this has become such an important issue for us to address. It is a quiet epidemic that has swept across America, driven not only by, I think, how we have used technology, social media in particular, but also driven by the fact that for more than half a century, we've seen a decline in participation in faith organizations, in recreational leagues, in other community organizations that used to bring us together. We're seeing so many people who are experiencing trauma in our society, whether that's from violence or from other experiences. And that can often make people turn inward, especially, and shun other people, ironically, exactly when they need other people. And the absence of actually support and, in some cases, counseling and mental health treatment, people can have a hard time breaking out of that. So the bottom line is loneliness has been a crisis that's been growing. The pandemic added fuel to that fire for many people, increased loneliness in many people. But what we're seeing is that if we do not address loneliness, then I worry that it's not just our health that's going to be at risk. It's our ability to overcome the big challenges that are facing us as society right now, whether that's economic inequality, whether it's climate change, whether it's the challenges that we have with racism and discrimination, whether it's other difficulties that we have in the cultural divide that we seem to be experiencing. All of that will be hard to contend with and to address if we can't pull together, if we can't address the disconnection that has seeped into our way of living.